Hello, everyone. Welcome to Bones of the Forearm. Bones of the hand will be covered in a subsequent video. So what we're really going to be talking about is this area right here, but we're also going to have to review the distal end of the humerus so that we can place the bones of the forearm in the proper areas. So let's go ahead and start with the book. There we are. Make this just a little bit bigger. I'm on page 111 in your book. Bones of the forearm and hand starts around 106, 107. So we are on page 111. And really what we have here is an entire forearm. Of course, we have a palmar view, and we also have a dorsal view so that we can see all the different landmarks. What I'm going to go over right now are these and these. Of course, like I said, the distal end of the humerus. We already know the proximal end of the humerus pretty well from all of the muscles that we've attached here, but we haven't really had any attachments at this end yet. So it really is worth reviewing all of these landmarks and of course learning some new landmarks here, okay? So I'm actually going to go into visible body to show you some of these distal humeral landmarks. Make that a little bigger. And remember, we can turn this all around, right? Backward and forward, do. Let's move that just a little bit there. Okay, so what we're looking at here is an anterior view of the distal humerus. Now, the humerus on the screen is not facing the same direction as the humerus that I'm holding, but that's only because we are opposite one another. So either way, we have these lovely ridges that sort of flare out from the shaft of the humerus here. And these are pretty much exactly, they're named for exactly what they are. So here is the lateral supracondylar ridge, because it's above the condyle, supracondylar ridge. And this one right here is the medial supracondylar ridge. And they do not have those on the visible body. They just have the shaft of the humerus, right? But here and here are the supracondylar ridges. And those are listed in your book. Medial supracondylar ridge, lateral supracondylar ridge. So we'll go back and forth here. All right, what else do we have? Well, right here, right, we have the lateral epicondyle. Turn this around, it's kind of highlighted in blue here. This is the lateral epicondyle right here, this little bump right there. The condyle is really this part, okay? And I think on this one, that little bit right there, I don't know, I don't think they, well, anyway, can't get it to come up. Right here would be the actual condyle, and this would be the epicondyle. It's not very condylar. You know, you're used to big round things as condyles. Not so in the distal humerus. This would be the condyle. This little bit right here would be the epicondyle, that right there, okay? That means this is the medial epicondyle, and that's this right here. That purple, now blue, right? That's the medial epicondyle. That one's really easy to palpate. We already know that. We can feel that all the time on ourselves. Most of us can even see it through our skin. That's the medial epicondyle, okay? Which means that this part right here-ish is the medial condyle. Okay, whatever. Moving along. So we have a dip right in here. Let me turn this right here. That's this blue part right here. I'm going to highlight it. That dip right there is the coronoid fossa. Coronoid fossa. So it's one letter different than coracoid. So make sure you do not confuse the two. This is the coronoid fossa, and it's going to receive the coronoid process when we get there. All right, so then we have these bumps down here. Well, two of them are the same thing and one of them is different. So this right here, this part right here, closest to the medial epicondyle, this is called the trochlea, and it's this bump and this bump. Okay, this bump and this bump. Next to the trochlea, we have this one here. It's called the capitulum. Even though it looks like it's all the same thing, it's not. This is the trochlea, this is the capitulum. Okay, two very separate things. The trochlea is closest to the medial epicondyle to give you reference. The capitulum is closest to the lateral epicondyle. Now, the ulna is actually going to fit really nicely around the trochlea here. Okay, to make that hinge joint at the elbow. So let's turn this around. Okay, so on the posterior side, ooh, look at that lovely fossa. That is another fossa. It's just opposite the coronoid fossa. This one is called the olecranon fossa. Okay, olecranon fossa. The olecranon fossa fits the other side of the ulna here. Okay? Again, making that lovely hinge joint. See how that just sits so nicely right in there when the elbow is extended. Okay. And then, of course, all of your other landmarks are still there. We have the medial epicondyle, lateral epicondyle, trochlea. The capitulum is more in the anterior. Okay, so we've gone over pretty much all of the ones on this page. So we did lateral supracondylar ridge, medial supracondylar ridge, medial condyle, medial epicondyle, lateral condyle, lateral epicondyle. We did the coronoid fossa. Right next to the coronoid fossa, so here's the coronoid fossa, there is the ever so smallest dip. It's very difficult to even see. It's just a teeny tiny dip there. That's called the radial fossa. You may see this in other books, you may not because it's so small, but that's where the radial fossa is located. We had the capitulum here and the trochlea here, which of course sort of held the ulna. On the posterior side, again, lateral supracondylar ridge, medial supracondylar ridge, medial epicondyle, lateral epicondyle. And then we have something here that's the groove for the ulnar nerve. I don't need you to know that. Okay, it's not relevant at the moment. Okay, moving on to the radius and the ulna. Radius and the ulna. The radius is this one. The radius looks very, very different from the ulna. You see, easy to tell them apart. The radius has this head here that is rounded and flat, and it actually looks like the head of a nail. The ulna looks like a C shape, almost like it's, you know, one of those grabbers that you use to pick things up. That's the end of the ulna. And of course, as we saw, it fits around the humerus, the distal end of the humerus like this, right? Sits very nicely there. The radius, on the other hand, is going to sit up against the capitulum. See that there? I'll try to turn this around here. It is not part of that humero-ulnar joint there. It is next to it. So we'll talk about that in a minute. But the radius is on the thumb side. Okay, radius is on the thumb side, like this. Ulna is on the pinky side. Okay, like this. In fact, this landmark right here that you can see on the screen, that's this thing right here. That right there sticks out. Okay, that's a good way to remember this. Radius is the thumb side, ulna is the pinky side. And of course, we are going on to the hand in another video, so we're not going to do that right now. So let's take a look at some of these landmarks here. And we'll start with the ulna. Move that over. So the ulna has two ends, one really skinny end and one, much larger end. And if we look at an anterior view of this, you can see that it does have that notched C shape here. Okay. Now I don't like that they did this because they're showing you a posterior landmark on the front. I don't know why, but this is the olecranon process on the posterior side. That's this. Your elbow, the pointy part of your elbow, that's the olecranon process. Okay, that's that right there. That's on the posterior side though. So it says, I don't know, that's weird. Anyway, on the inside here, we have a trochlear notch, which makes sense because we said that it articulates with the trochlea. Then we have this little pointy bit right on the end here. That's the coronoid process. I had mentioned that. It fits into the coronoid fossa. Okay. Coronoid process fits into the coronoid fossa. Lovely. I like things that are easy. Okay. Now, right here, this flat little bit that's just next to the coronoid process. See, it almost looks like it's shaved out right there. That's the radial notch of the ulna. So the radius is actually going to sit right up against that radial notch there. Actually, it's going to go this way. Okay. And it fits so nicely in there, just like it's made for it. Okay. Distal to that then is this bump right here. That is called the ulnar tuberosity. Right there. That's the ulnar tuberosity. Okay. And then just below that, or just distal to that, we have something called the supinator crest. And it's really hard to show you on this bone because there's so many shadows that are made by it, but that's all right. Right about here is the supinator crest. Okay. Then we have the shaft of the ulna. It's a rather thin bone, right? Not much going on there, either anterior or posterior. And then down at the distal end of the ulna, we have that point that I was talking about, this one right here. This is called the styloid process of the ulna. Styloid. Styloid means pointy thing, like you're indicating something. Maybe some of you have a stylus pen that you use with your phone or with your tablet or maybe even your computer. I'm looking for the actual definition. It is in your book somewhere. I just can't remember which pages these are on, right? Because they're at the bottom of pages kind of randomly. Anyway, stylus, styloid, means pointy thing, basically. Okay, so there's the styloid process of the ulna. And as I mentioned, just as a reference or review, that's the styloid process of the ulna. Everybody can see that, right? Okay. So moving on to the radius, it looks completely different, right? So this part is the head of the radius, the flat bit. This is the neck of the radius. And then you have this really large radial tuberosity. This whole thing here is the radial tuberosity. The radial tuberosity is big because we have the bicep aponeurosis, bicep tendon attaching there. So we have to have sort of a big landmark for that to attach to. So that's the radial tuberosity right there. And then of course you have the shaft of the radius, like the ulna, not a whole lot going on there. And then at the end of the radius, you have a pointy bit. So you have another styloid process of the radius on the opposite side of the styloid process of the ulna. The styloid process of the radius is a little bit more difficult to pick out because it's covered with a lot of tendon. However, you also have a landmark on the opposite side here. It's right there, right? So here's the styloid process of the radius. That landmark right there is called Lister's tubercle. This one you can palpate sometimes. Lister's tubercle is actually right there. And of course I'm bony, so you can see that. So here's a styloid process of the ulna. Styloid process of the radius actually is up here. And then right there, yes, right there is Lister's tubercle. Okay. Bone, I can feel it. That's Lister's tubercle right there. That's it right there, that bit. Lister's tubercle is actually named after a man called Joseph Lister, who happens to be the father of modern antiseptic surgery. In other words, he was the one who figured out that germs cause infections, and he figured out a way to prevent that. So he was the one who really started incorporating these antiseptic techniques into surgeries in order to prevent infection and high mortality rates, because quite honestly, surgery was hit or miss. You know, the surgery might have been successful, but then later you die of sepsis or you die of a massive infection or something like that because things weren't as clean as they should have been. Joseph Lister is the one to credit for that. You may have heard his name in part before. He is sort of, he did not invent Listerine. However, Listerine is named after him because Listerine is an antiseptic mouthwash. So there you go. Joseph Lister has his own tubercle. Father of modern antiseptic surgery. All right. That is it really for the landmarks of the radius, ulna, and distal forearm. Ulna, at the radius, and the distal forearm. Please study these landmarks, know them, review them before we move on to the hand, okay? All right, that's it. I will see you soon.